Okay, so the Shockwave system here, this is kind of an updated video. We found out some quirks about it since our last video. So we're just kind of starting over. That's the on switch. To get into this, you press a bunch of zeros until it lets you in. There we go. It doesn't matter which one of these icons you press because really they're all the same. The pictures are different, but it really doesn't matter which one of these you press. You're going to be setting the parameters up yourself. Once you go in here, you're going to set the intensity, so the frequency, and the higher frequencies are usually more comfortable. So if you're not sure how a person is going to respond, start with a higher frequency. You could always turn it down as you go. And then the energy level here, it goes up to 8. Again, you can start it kind of low and work up. And we're going to have more specifics on those protocols, but this is just a review of how to get it started. Now, to actually activate the machine, you have to press that button after you press this one. Okay, make sure everything is intact. We are finding that this works much better without ultrasound gel, and I'll show you how we do that. We just move the unit periodically to cover the desired area. Just know, once this has been pressed, you press this and it's going to go. You need to have this pointed, or you need it to be on a person in order for it to work properly. If you're just letting it activate in the air like this, the little piston in there gets caught. Sometimes it gets caught anyway, and there's a way that you dislodge that, and I'll show you that in just a minute here. So I'm going to press this on. I'm going to work an area. And you can see that's a high frequency. I can turn down the frequency during the treatment. I could turn up the intensity during the treatment. Sometimes it gets kind of achy, and then I'm going to press that button. And so I've just worked that area. It leaves a nice little circle, and then I can move to a new area. So that's how you move it. You turn it off, you move it, you turn it back on. And occasionally, again, the piston gets stuck. And again, you're just going to cover that entire area. You have 2,500 percussions altogether. I've used almost 500, so you just kind of map out an area and make sure that you've covered your area by the time you get to that 2,500. Right now, with the frequency up a lot, it's going to go pretty quickly. I want to go deeper, so you'll lower frequencies, you get a lot deeper penetration, so I'm going to go lower on the frequency now. And you can hear how that's slower, but again, it's a lot deeper. Make sure you use this on yourself several times before you use it on the patient. And again, if you're just letting this thing go in the open air, see how it gets stuck in there? So to dislodge it, sometimes you can just hit it like that. We'll see if that worked. And it did work. Occasionally that will not work. I'm going to turn this off right now. Occasionally it will not work, and you have to take this distal head off. Be careful because it can unscrew from there as well. But if you're ever having difficulty with this, you'll see that there's a little piston in there, and it's in proper position now, but it can get stuck in there, and you just poke this little thing in there to get it out. It also gets dirty in here sometimes, and so then we clean it. it with this brush. And again, I'll likely be the one that does that. This is what the piston looks like. That's in the inside. These things wear out and we replace them. You can see that we have some replacements in this jar right here, but this one I think still has some life left. But that's how you disassemble it. I wouldn't worry as much about disassembling this as just knowing that occasionally this piston gets stuck in there, and you can see right there it's kind of stuck right there. I'm going to press that down and it's unstuck now. And then you can put different heads on if you want to cover a smaller area. Then let me just put that head on. But again, make sure that you use this on yourself a few times before using it on a patient. Also, wait until we get parameters to make this clinic-wide. This is just a little bit of a preview that I want to introduce it, but we will be using it more and more and start delegating it eventually. But for right now, us PTs are just kind of playing around with this, and some of the assistants have been introduced to it as well. So we're just kind of gradually developing some protocols and figuring out the little quirks of this thing.